March 2021. And at this time, we will have the invocation, which is followed by the Pledge of Allegiance. The invocation will be given by Vice Chairman Ronnie Reese, and the Pledge of Allegiance will be given by Commissioner Jeff Peel. If you would, Commissioner Reese.
Let's pray. Father, we come to you today, and we just thank you for the blessings of it. Thank you for all that you do for Alexander County. Pray for all our county employees, all our emergency services, law enforcement, police, fire department. Protect all of those each day as only you always do. Lord, we pray for this time that we're going through, that you put an extra hedge about Alexander County and our citizens. We pray that you take us through this virus that's going on, that you move it on the cross and move it out of us. That's in your will that you can do those things. Lord, we pray that you give us direction for our meeting tonight, that we make wise decisions, that we move Alexander County forward. Pray for each family, each person that's represented here. Lord, bless them. Lord, all this we ask in your name. Amen.
Amen. Mr. Peel.
All right, if you would, please join me in the pledge. Attention, salute, pledge. I pledge allegiance to the flag of the United States and to the republic which it stands, one nation, under God, indivisible, with liberty and justice for all.
Does any commissioner have anything that they need to report tonight? Well, I just want to talk about one thing. We've been talking about litter, and a lot of people's been talking about it this past week. My wife was cleaning up litter down at the end of our driveway, and for some reason, it seems like every time somebody wants to come around the curve, they come around the curve and they throw all the garbage out at my driveway. So she was out there cleaning it up, and a family, Angel Herman, and her kids came by and saw what was happening. They just stopped, and they all got out and helped her continue to clean it up and got everything cleaned up, looked real nice. And then there was a large chat that started on Facebook about a lot of the littering going on in the county and our highways being so dirty with trash and different things. And so we just felt like that maybe we need to take a step back and look at things and clean this mess up. There's no reason in throwing trash out the window and letting someone else clean it up. It only takes a little garbage bag in your car to be able to keep this trash in there, then to get home properly dispose of it. But I know I've spoken with Gary Herman, and I think we all have it. We'll look into this and see what we can do about trying to get some events to clean up our roadways and make them a little nicer. Does anyone else have anything?
Well, Larry, the crazy thing too is that every gas station you go to has a trash can. So I mean, just throw it away when you get gas.
Right beside the gas pump, every one of them, you know. And it just takes an extra second to do that to make everything look pretty. And you know, take pride in your community and take pride in your state and your country, and try to throw this litter away. Don't throw it out the window. Just throw your trash away and the proper dispose of. Anyone else? So we'll have the adoption of the agenda tonight. We have one item that we need to add, and that is a resolution from the economic development that needs to be added. And we'd like to make that 1A, if we could, please. And I'll read that resolution when the time comes. And it's the Alexander County Resolution application for the North Carolina Department of Commerce Building Reuse Funds for Project Buckeye 1. And with that addition being added as 1A, I'd recommend approval of the agenda as it stands.
Make a motion to approve agenda with the addition of 1A.
Do we have a second?
Second.
Motion's made and seconded. Is there any discussion? There being none, all those in favor just indicate by raising your hand. Right hand. Thank you. Thank you very much, gentlemen. Okay, so Madam Clerk, I believe we spoke, and there's no one on the agenda tonight for public comment. Is that still correct?
Yes.
Thank you. Item 1A Alexander County Economic Development Resolution. This is a resolution for economic development, and it says on March 1st, 2021, Alexander County resolution application for North Carolina Department of Commerce building reuse funds for Project Buckeye 1. Whereas Alexander County's Board of Commissioners has indicated its desire to assist in economic development efforts for business and industry within Alexander County. And whereas the board fully supports the proposed renovations planned by Project Steeplechase, which will result in the renovation of existing industrial space and will create a minimum of 10 new jobs for Alexander County. And whereas the board wishes the county to pursue a formal application for building reuse funds in the amount of $80,000 from the North Carolina Department of Commerce. And whereas the board certifies it will provide up to $4,000 representing the 5% match required to the final grant award amount, and also certifies the county will adhere to all requirements of the North Carolina Department of Commerce Building Reuse Grant Program. Now, therefore, be it resolved by the Alexander County Board of Commissioners, the Alexander County authorizes a formal application to the North Carolina Department of Commerce Building Reuse Grants Program in order to provide assistance to benefit Project Buckeye 1, that this resolution shall take effect immediately upon its adoption. Adopted this first day of March 2021. And gentlemen, I present that in the form of a motion to approve. Do I have a second? Motion's made second. Thank you, Vice Chairman Reese. Any discussion? There be none, all those in favor indicate by raising your right hand. Those opposed likewise, the motion carries. Thank you very much, gentlemen. Item number 3, Bethlehem Sewer Extension Project. No, excuse me. Item number 2, public hearing, approval of road names, Harvest Ridge Road, County Manager Mr. Rick French. And at this time, gentlemen, I make a motion to go into public hearing.
Mr. Chairman, I make a motion that we go into public hearing for the approval of road names.
Do I have a second?
Second.
Motion's made second. Any discussion? There be none, all those in favor indicate by raising your hand. All those opposed likewise. Thank you. Mr. French?
Yes, sir. You have one road name to consider tonight, Harvest Ridge Road, which is off Eichard Ridge Road. That's the only one we have for tonight, Mr. Chairman.
Okay. Do we have anybody want to make any comments or anything about this? If not, I entertain a motion to close the public hearing.
I make a motion we close the public hearing on road names.
Do I have a second?
Second.
Motion's made second. Any discussion? There being none, all those in favor indicate by raising your right hand. Those opposed likewise, the motion carries. Gentlemen, what is your pleasure?
Make a motion to approve road name as stated.
Second.
Motion is made second. Any discussion? There being none, all those in favor indicate by raising your right hand, please. Motion carries unanimously. Item number 3 on the agenda, Bethlehem Sewer Extension Project update. Mr. Benji Thomas with West Consultants. Mr. Thomas.
Good evening. Good to be with you virtually. So I will give you a brief update on the status of this project, the Bethlehem Sewer Project. Most of my information has come, of course, from Shabaldine Engineering. Pleased to report that the project is substantially complete. All of the gravity, sewer, and the force main has been installed. That's a little over 22,000 feet. The Wittenberg Springs and Heritage Village pump stations are complete. The new pumps are installed and are in operation. All of the pipe and the pumps have been tested and passed their tests. The engineer certifications have been submitted to the state for all portions of the project except for the pump stations and a small portion which is on Chigger Ridge Road. Those are expected to be submitted this week. So substantial completion deadline was March 11th of this year. So they, the contractor, Two Brothers Utilities, was able to meet that or beat it by about a week or 2 weeks. The only work remaining to be done is some cleanup and reseeding and some minor, I'm sure there'll be a punch list after a final inspection, which has not occurred yet. So that's the status of the construction. On the financial side, Jennifer Herman and I worked together along with the state funding folks, Division of Water Infrastructure, and the county did receive payment number 3, loan payment number 3, or loan disbursement. It was just under $900,000. It was actually $48,100 less than what we requested. And Jennifer and I worked with the state and figured out the reason for that, and that's been resolved so that when we turn in the next request, that money can be claimed. The next request will be approximately $250,000. There will be a final change order to reconcile all quantities, actual exact footages of pipe and so forth that have been installed versus what was estimated back when the project was bid. So I'll be checking on that along with Mr. Shabaldine. So that's the status. Pleased to report that it is essentially complete, and there'll be a meeting this Thursday to catch up on any loose ends, get a report from the contractor. And with that, I'll be happy to try to answer any questions if I can.
Very good. Thank you. Does anyone have any questions?
Good news so far.
Absolutely. Absolutely. And so it's good to know that it's getting finished up, and we'll be maybe hooking on some new customers. That'll be very good. Very good. All right. If there's no further questions, then Mr. Thomas, thank you very much, sir.
You're welcome. Thank you.
Yes, sir. Item number 4 on the agenda tonight is wireless broadband expansion project update. Mr. David Moose, the compliance procurement specialist.
Thank you, Mr. Chairman. Just want to bring the board a brief update on our wireless broadband expansion project tonight, let you know where we stand with the project. The project is moving forward. Right now, we are reviewing a contract. Staff have completed our review with it. We forwarded it on to legal staff for a final review and comment there. So we anticipate having a contract signed hopefully very soon. We held some planning meetings with the Open Broadband staff. There have been a few minor changes to the original proposal, most of which include changing around a few of the tower sites. In the Ellendale area, there were proposed on the original proposal 3 tower sites. One was a privately owned tower site, noted the Pearson Tower. The other one was a commercial tower on Barrett's Mountain and a commercial tower on Stafford Mountain Lane off of 127. The Pearson Tower was eliminated from the project by Open Broadband due to the fact that the tower, it was determined that the tower is not going to be tall enough to reach over the trees to afford appropriate transmission. There was a second tower that was available. However, they didn't have enough space on the ground to anchor that one, is what we were told. The the Barrett's Mountain and Stafford Mountain towers have been eliminated from the project, but replaced by a commercial tower over on Willie McLeod Road. So just in the same general vicinity as the Stafford Mountain Tower. And that was allowing Open Broadband to save a little bit with lease costs, but still serve virtually the same number of homes. The other major change with the project is that we are breaking that into a 2-phased project. The reason being is that the tower spaces that are serving Ellendale and the western part of the county are already in place and ready for equipment to be mounted and turned up and customers to be added. However, we had a few issues with the proposed tower sites to serve the eastern and southeastern portion of the county. One site was an LTE hub that was to be mounted on a chicken farm, a poultry house and a chicken farm. And Open Broadband informed us after further evaluation, it was determined that the elevation and location of that was not going to be sufficient to serve customers. So they recommended eliminating that. The other site is a site that we were looking at maybe partnering with a private owner, maybe locating it there, but the tower does not currently exist. So at this time, there are not any approved tower sites to serve the eastern or southeastern portion of the county. That being said, in interest of moving the project forward, we recommended to Open Broadband to break it into a two-phase project where phase one would include the completing the work for the Moore Mountain Fire Tower that will serve Vashti and Sugarloaf, and the vertical bridge tower, which is the tower on Willie McLeod Road that would serve Ellendale. Those are ready to go now. While they are working on those and installing equipment and turning up customers, we've asked Open Broadband to continue researching additional locations and working with county staff to identify potential locations where they can serve the eastern and southeastern portion of the county. That allows the project to move forward and continue moving forward without, excuse me, being held up by the work that's not ready to be done. And I believe that's all I have. Do you have any questions?
David?
Yes.
Do you say there's a tower going on Moore Mountain?
There's actually already an existing tower. It's, I believe it's owned by Sugarloaf Fire Department. So there's actually a tower structure there that they have spoke with the owners and are looking at putting equipment up there.
Okay. I've had quite a few people say that their service is really bad off of the Sinclair Road area. Don't know where they're being served from, but that would be, you know, kind of between Ellendale and Sugarloaf. But any idea what's causing that?
I'm not sure, and I'm actually coming to you from Little River Baptist Church, which is just down the street or just down the road from St. Clair, and service seems to be working okay here. I will certainly pass that concern along to Open Broadband staff and have them check into that. The addition of the Moore Mountain Tower and the additional antenna that they're putting up on Lenny's Mountain for the backhaul may help to improve that some. That may add additional bandwidth for customers. I know I've seen some things on Facebook where people are complaining about speeds lagging and things like that, and that may be a bandwidth issue with the current equipment that's on Lenny's Mountain right now. So, but I will pass that on to Open Broadband and try to get an answer for you.
Yeah, they said that they, you know, when they talked to Open Broadband, they really didn't get much of a response other than, you know, you're just not getting good service basically. And it's several people across St. Clair Road.
Okay, I will certainly pass that along.
Thank you.
Yes, sir. Any other questions?
Okay. Thank you, David. We appreciate the update.
Thanks, sir.
Yes, sir. Item number 5, North Carolina Department of Transportation road update. Mr. Gary Herman, Public Information Officer.
Thank you, Mr. Chairman, Commissioners. It's a pretty good report we have for you. Of course, this is an update regarding roads which were compromised during the flood on November 12th, which will be forever etched in our memory. We are pleased to announce, of course, that Millersville Road, Nestor Road, and Smith Grove Church Road are now open. Alexander Bridge number 3 on Cheatham Ford Road. They are under contract to replace the bridge. They're currently in the design phase, and the contractor is on site removing debris from the flood and also some of the bridge that has already been demolished. And they are still sticking to their estimate of the end of this year, December 2021, to have that bridge completed. Pre-construction meetings were held on February 2nd for the following projects, that being Rocky Face Church Road at Presley Court, 591 Berea Church Quincy Road, 1949 Berea Church Quincy Road, and Sloan Road. And completion for those projects are scheduled for completion mid to late April. Pre-construction meetings to be scheduled soon by the contractor. That is a site at 7858 Cheatham Ford Road, Hopewell Church Road at Mill Creek, and 1069 Lackey Mountain Road, and also Judd Smith Road at Marlow Road. Macedonia Church Road at Glade Creek, the contractor is on site doing preliminary grading and erosion control. At 2535 Rocky Springs Road, contractor was mobilized on site February 17th. And 958 Sulphur Springs Road, the pipe is installed. They've partially backfilled and are forming a concrete head wall, which I talked to DOT, and that's kind of like a concrete funnel that helps the water come into the culvert. The only one that they've made no progress on is Old Wilkesboro Road near JC Park Loop. They're still addressing the utility conflicts there. There's multiple utilities involved, and they haven't come to a consensus with everyone involved there. So that's the roads report. Overall, I think the DOT's done an outstanding job considering the amount of time that has elapsed since the flood occurred here in the county. And they've been very quick to respond to our request for information so we can disseminate that to the public. So any questions?
Yes.
When you mentioned Old Wilkesboro Road, not coming to a consensus in regards to the utility companies, is that all utility companies or just a specific one?
Well, I was speaking with Cole Gurley, who is the Division 12 engineer. He didn't specify if it was all of them or one of them, but he just said that at this time they hadn't been able to make a decision or move forward with that project yet.
Okay. What kind of decision do you got to make there? Yeah, we have a water line. Yeah, we have a sewer line. Yeah, we have a fiber optic line.
It's all about
going through here. So what do they have to decide?
Apparently, it's all about location of where the lines are going to go. It's with where the road has broken up, and he said it's just taking longer than he had hoped.
It's a 60-foot hole. They're going to go back in that hole. What can be so complicated?
I kind of have the same feeling. I don't know. Good question.
Thanks, Gary.
You're welcome.
Anyone else? Thank you, Gary. Good job. Appreciate it.
You're welcome. Thank you.
Item number 6 on the agenda: board appointments and reappointments, equalization and review board, farmland preservation. Mr. Rick French, County Manager.
For the Equalization Review Board, appoint Alan Grant for 1 year, reappoint Doug Ramsey, David Odom, Linda Barnett, Bobby Norton, Donovan Douglas for 1 year. And for Farmland Preservation, reappoint Coy Reese, Scott Sink, Dustin Queen, Tim Glass, and Eugene White for 4 years. Those are the appointments for tonight, Mr. Chairman.
Thank you, sir. I entertain a motion to approve.
Make a motion to approve.
Do we have a second?
Second.
Motion is made and second. Any discussion? There being none, all those in favor indicate by raising your right hand. Those opposed likewise. Motion carries. Item number 7 on the agenda is the budget ordinance amendments, number 56 through 62. Mr. French, County Manager.
Thank you, Mr. Chairman. Budget Amendment 56 is the budget for amended estimate of the 2020 Help America Vote Act grant funds, which will result in a net increase of $64,552 in the general fund. Budget Amendment 57 is to increase the Sheriff's Office budget to purchase new tasers with federal grant funds that are passed through the North Carolina Department of Public Safety Governor's Crime Commission. There's no local match required, and that will result in $24,496 increase in that line item. Budget Amendment 58 is to increase the health department budget for additional federal funds for COVID-19 ELC enhancing detection and vaccination program. That will result in an increase of $48,470. Budget Amendment number 59 is to increase the health department budget for donation received for behavioral health program, which will result in an increase of $4,574. And budget amendment number 60 is to adjust DSS budget for HCCBG funds for from housing home improvements moved to in-home services to maintain the highest possible care to county residents while adjusting the HCCBG allocated funds to counter the previous nutrition program shortage with a county match. And that will result in a decrease of $1,090. And the last budget amendment is to increase the DSS budget for CARES Act funding to assist with expenses of child protective services and adult protective services, teleworking from home. Planned use of the funds includes computer equipment and supplies, and that will result in a net increase of $7,500. I'll be glad to answer. Wait a minute, I have one more. Number 62 is to increase the library budget for donations received and revised for the revised estimate of state aid funds, and that will result in a net increase of $5,547. I'll be glad to answer any questions, Mr. Chairman or board members.
Mr. French, I'd like to say that that's several budget amendments, but it's about $190,000 in money that was not ours that we're getting. So I think that's a good report.
Yes, sir. We'll take it, won't we, sir?
Absolutely, all day. That's good math.
Anyone else? I entertain a motion to approve the budget amendments.
Mr. Chairman, I make a motion that we approve the budget amendments as stated.
Second.
You have a second? Motion is made second. Any discussion?
I would just say if anybody else wants to give us money, they can.
Excuse me?
I would just say that if, you know, we need to put the word out that if anyone else would like to donate money to the good of the county, we will gladly accept it.
Always take free money, right?
That's right.
Okay. Any other discussion? All those in favor indicate by raising your right hand. Those opposed likewise. Motion carries. Other business, county manager's report.
Thank you, Mr. Chairman. Just a couple things to mention. One, as you are all aware, the Alexander Soil and Water have been providing us information concerning the EWP Emergency Watershed Protection Program. Alexander County's portion of those funds is 25%, not 2.5%, but 25%. We have a little revised number that takes the county share to $19,875, but that's not a final number yet. So Soil and Water is working very diligently, is trying to get that number to us. That's a lot better than we earlier thought that number would be. So we'll be reporting more about that. Saturday, May the 1st is Alexander County Household Hazardous Waste Day and Document Destruction Day. And we've been having this for many years. That will be again May 1st from 8 to 12 noon at the County Administration Building parking lot. So we'll be providing you more information on that as time goes on. And I'll be glad to answer any questions, Mr. Chairman. I have some things for closed session later on.
Very good. Thank you, sir.
Yes, sir.
The consent agenda, entertain a motion to approve.
Make a motion to approve consent agenda as given.
Do we have a second?
Second.
Motion made a second. Any discussion? There being none, all in favor indicate by raising your right hand, please. All right. So the motion carries. The Board of Commissioners, at this time, we'll go into the Board of County Commissioners Consolidated Human Services Board meeting. And after the Human Services Board meeting, we will adjourn, and the Alexander County Board of Commissioners will adjourn at that time for the purpose of going into a closed session. we will reconvene out of that closed session for the purposes of adjournment only. So at this time, we'll start the Board of County Commissioners Consolidated Human Services Board meeting. And we welcome each and every one of you to spend time with us here as this is conducted. Did we have a public comment from anyone tonight, Leanne, that you know of?
We did not. And I hope Jamie concurs.
Thank
with
you.
that.
I concur.
I was going to ask you, yes. Jamie, did you have any?
No, I didn't have any.
Okay. All right. Health Department update, Billy Walker, the Assistant Director of Health Department, COVID-19 update, Billy.
Billy, we can't hear you still. We were having technical difficulties with both programs earlier, so.
Well, I kept noticing a lot of things there. It looked like about everybody was frozen on my screen. That's why I was sort of like, is everybody okay? Right, but I see them moving now, so. Billy, can you hear us? Leanne, since we're not able to hear Billy.
She cannot. Okay. I'm
This
not
is
sure
what
what the backup
happens
plan.
Right. These things happen when you're trying to do Zoom live and having these meetings, and technical difficulties can happen.
They certainly do. Billy, the only thing you want to come to my office and present, I know you've got them printed. We've had trouble with our Zoom, something with I don't know, one of the last updates. So we've had IT out helping us, but it's great when it works, but it's challenging when not. So I know, luckily she's just across the hall and she's coming this way. When she gets here, I'm going to trade chairs with her. She's going to give you our COVID update. Okay, let me get her slides up. All right, minor technical difficulties. Okay, all right.
Before Billy, can you guys hear me?
Yes.
Okay, thank you.
They should be able to hear you.
Okay, so let me move this. Okay, so I'm going to give you a COVID-19 update as of today. We've had 3,918 cases of COVID. Sadly, we've had 84 deaths, and there's about 13 plus or minus in the hospital to date. We are still testing Monday, Wednesday, Fridays at 10 a.m. We've seen a significant drop in the people that are coming out to be tested. We've changed how we have them calling in for appointments due to the overwhelming calls that we've had for the vaccine. So now they can call just one specific number and schedule an appointment for the testing. We did receive Pfizer and Moderna vaccine. We currently have no Pfizer to date, and we are not sure if we're going to get any more, but we do have Moderna. Moderna is the 2 doses, and they're 28 days apart. We were receiving 300 doses a week, and now for the last 2 weeks, we've had 500 doses a week. That will change next week, and we're unsure whether we'll go back to the 300, stay at the 500, or get more. It is every 2 to 3 weeks notification. I want to share with everybody how the call volume has changed. We have been very busy this whole year with COVID, but it was unreal the amount of calls that we encountered when the vaccine was here. And we had IT run us a little spreadsheet to show the difference. We knew we were so very busy with the calls. We just couldn't answer them. And I know people didn't understand why we weren't answering the phone, but this graph will show just how many phone calls we did have coming in. It almost tripled in a month. And it almost overwhelmed our phone system. We had IT out here. We had the county admin was helping us answer phones and make appointments. It was unreal the amount of calls we were having. We also had IT put in a hotline that we had never had before, and we had 64,681 calls through that hotline. That's on top of the other calls on the other lines. So the next slide is it'll just show you the jump in calls in a month. It was just unreal. So I'm going to talk about the vaccine distribution. Currently, we've received from the state 6,550 doses, and we have given 6,458. So we're on top of what they want is they'll send the vaccine on Tuesday. They want you given that vaccine Wednesday, Thursday, Friday. They want all those logged by the next Monday. And so if they're not, that may hinder us getting the next vaccine. So we've had people working not only to schedule appointments, but also to give those vaccines, and then also work overtime to plug those vaccines in the system so that the state can see that we aren't sitting on doses. I put a little bit of data out here just to let everybody know where we're at as far as our 65 and older population, and just the demographics that we have in our county and what we have vaccinated so far. So quarantine changes a tad after vaccination, and I wanted to update everybody on that. So the CDC has changed that once you have been vaccinated 2 weeks after your second dose, then you are free to not have to quarantine if you've been around somebody with positive COVID for the next 3 months. So it gives you a window of about 3 months that you don't have to quarantine. Same thing if you've had a positive COVID test, then you don't have to quarantine for those 3 months as well. I've been asked, I do think I've seen some data from other clinical studies that they're doing. Of course, it changes all the time just because this is so new, but they're saying that the immunity is longer than that, and that we probably will see an extension of that immunity. But right now they're going on the 3 months. So I think that is all. No, our vaccination plan has changed, of course, again. So we think we've done a good job of getting to our phase 1, the healthcare workers and long-term care staff and residents. Phase 2, our older adults, we think we have reached out as much as we can to our older adults, 65 and older. And, we're still vaccinating both of those groups as they call. So now we have moved to the phase 3 frontline essential workers, and I highlighted those in yellow so that those would stand out. This is who is next in line for the vaccine. And so we are really focusing right now on the teachers and the childcare workers. And we are currently getting ready to vaccinate all of our educational staff and our childcare workers on Wednesday. So we've got 2 sites set up to do those vaccines, and the child care workers, we're going to stay till 7 that night so that they'll have a chance to come in. Some of them, they allow the families to work. Some of our families, a lot of our families work out of town, and it's hard to get to the babysitter by 6. So we're going to stay till 7 to get those vaccines completed. But I put who is in the next category. And so it's critical manufacturing, education, essential goods, foods and agriculture, government and community services, healthcare and public health, and public safety and transportation. So it's a big group next. So I'm sure that our phones are going to start ringing again off the hook because everybody's going to want this vaccine. This plan does depend on vaccine availability. So I just said we get 500 doses a week. I think we had 354 signed up just through our education only. So manufacturers, we've had a list going for several weeks with different companies trying to go ahead and get a game plan of how many of their employees are going to want that vaccine to send us a spreadsheet so that we can know a day and specific time to do these vaccines. And we will start manufacturing beginning on March the 10th. I wanted to add the hotline for the appointments. It's 828-352-7724, or they can go on alexandercountync.gov/COVID for the online submission form. We recommend that they do that. Even though they go and do the form, it actually sends it to our email to the health educator who's taking those calls. So she's going to get that, and she's going to put them in what category they called in, or what they fit in, and then whatever order they called in, they'll be scheduled. And that's it. Do any questions?
Billy, I have a couple of questions real quick.
Okay.
On the 6,500 vaccines that have been administered, do we know like how many of those were out of county folks versus in county, or do you track that?
We don't track that because the state says the only thing we now can turn away are out of state. There for a while, I think lots of people were coming across county or state lines to get vaccine. And so the only thing they did say is now you don't have to give it to out of state. We have to legally give it to anybody in North Carolina.
Sure. Another question is, are you seeing anybody turn away from the certain types like the Moderna, the Pfizer, and possibly the Johnson & Johnson?
Yeah, I do think that some people have heard one side effect, one company, the side effects are worse than the other, but we have not seen that. There's been just as many side effects with one as the other. I've not really heard anything bad about either one, as far as I wouldn't take one or over the other. Johnson & Johnson, of course, we did hear that it got pushed through, and we do know it's coming to North Carolina. Do I think we'll get some? Yes. Do I think we'll get a lot? No. But it's only 72% effective, and that number changes. It was 65, and then it went to 68. So, but that is, let's say you're more of a healthy individual, then your immunity to the 72% is better than a person who is at risk, older, who won't be able to bounce back from the COVID. Then you would give them those ones that are 94 to 99% effective. I will say that I've gotten lots of questions about immunity, and I think that if you have had the disease, you do need to wait that 90 days, not only because you've still got active immunity going on, but also we've got such a limited amount of vaccine that people who haven't had the disease, they don't have immunity. So we are saying save those doses for the people who have not had the disease yet or have not been vaccinated. Then after the 90 days, I've been telling people, go get an immunity test. The state doesn't look at the immunity antibody testing as getting out of quarantine, which I think they should, because I think immunity to whether you've had active disease or immunity whether you've had that vaccine, you still got an immunity. But they're saying no. So, but I do think until you no longer have immunity from the disease, I would hold off until you got that vaccine.
Thank you.
Anyone else have any questions? All right, good deal. I mean, it sounds like things are going well, and it's nice to know a lot of people get the vaccine now. But part of the reason they weren't getting the vaccine, most people need to understand, is the health department was not getting the vaccine shipped to them. So therefore, you all were shut down for a couple of days because of that. And
Yeah,
but the health department, when they have them, you've been giving them out.
Yeah,
so,
and
you know,
we are tied to those categories. So like even the manufacturers, those don't start till March 10th. So we can't go ahead and do those until March 10th. So I think a lot of it is just not really knowing what the state regulations and those restrictions are. You know, we had some snow issues and we didn't get the vaccine until the next week. So we had to change all those appointments, but we did it and we got them vaccinated and it went well. So we definitely don't sit on that vaccine because we want that next shipment the next week.
Absolutely. Absolutely. And we want the state to send it, not hold it up.
Yes. Yeah.
Very good. Thank you.
Thank you.
All right. I believe that Leanne, did you have anything that you needed to add? Okay. Leanne, did you have anything you needed to add?
Sorry. We play musical chairs. No, right. I'm very, I tell you, all of our helpers, we've had volunteers, pharmacists, EMS continues to help us. I'm just very proud of the response and the dedicated staff. It's been a lot of work, but it's went well. We've had lots of compliments that it sure beats sitting in a drive-through line for 4 or 5 hours and not getting your vaccine. So most people are in and out in less than 30 minutes. So it's going very well. I'm very pleased and proud of our staff.
Very good. Thank you, ma'am. Item number 4, social services update. Linda Clemens.
Good evening. Can you all hear me all right?
Yes.
Okay. Thank you for having me again tonight. So when I was on a couple months ago, I focused a whole lot more on compliance requirements for DSS. This time I'll be talking about some budgetary challenges as we get ready for the budget season. So if we can put the slides up, the first thing I was going to talk a little bit is our aging population that we serve in our adult services program. It's projected in the US that the population is going to double from 2014 to 2060. So to reach the point where a quarter of our population is in that 65 and above. These two graphics show that. The first one, the volume, and the second one showing the increase of that population from the age 65 and above in that 24% at the top right of the bar chart. How does that impact us? Well, in Alexander County right now, our 65 population, my figures are a little different because I actually talked to Christine Gates and she got numbers from the Department of Insurance that said we're currently almost at 8,400, which is 22% of Alexander County in the 65 and above. And right now, of that population, we provide in-home services, but only to 1/4 of 1% of the population are actually getting those current services. That's 19 people. And we have 22 on that wait list, which would double how many we are serving. The nutrition program, we serve almost 1%, with 42 served at the congregate sites, which right now are a drive-through pickup for the most part, and another 28 at home delivered meals. And we also have a wait list there for another 15. When we get people on our wait list, our priority is always someone that has been identified by APS services. If they've been found in need of services, they are the first ones we try to get served and off our wait list. Unfortunately, the turnover on our wait list is very low. People can sometimes be on that wait list for a few years before they get services, which can be somewhat discouraging, and some people's situation may have changed and be in assisted living by that time. Some of why we have a wait list for home delivered meals and how we also prioritize who gets served is also based on the strict requirements on meal temperature and dietary requirements. So we have to serve people that are living near each other on the same route to keep within that temperature requirements. Unfortunately, we don't expect to be able to serve any more people in the future if we continue to rely on funding from Western Piedmont Council of Churches. That funding is based on county population, and our population is not growing, and the senior population gaining greater than our neighbors, and the total budget's not really increasing. So that brings up the question, are there other funding sources available? Could we partner with other community providers? We have met with Mobile Cafe. They are not, we actually talked to them about helping with some of that because of the high requirements on dietary and temperature. They're not really interested in being a provider under that program requirements. We may have the possibility of being more creative and doing something differently there, but it is things we're pursuing. And question we have is, does the county want to invest more? Or another opportunity maybe if we want to try to get some grant funds in place, which we believe some other counties do. Just to give you an idea of what the cost would be, home delivered meals are about $1,500 per person per year. The in-home services, I don't have that on there. It's around $2,600 per person per year on average. It can go up to $6,000 per person, depending on how many hours of coverage they need. Just so you know that. We do, even though we don't anticipate budget change there, at least into the next year, as we do tend to continue to work on improving quality of service to this population by partnering with the Senior Center and hopefully using some of their social and educational outreach to improve that aspect of our provision to the adult services program. That's really, also wanted to put a quick thank you to the volunteers. They are really part of our ability to provide to who we do provide to. And if we did get more meals, we would not envision any increase in budget for delivery. We would increase our volunteers. Switching areas to the challenges right now we're facing in economic services. We are just starting. I talked about this last time, the Medicaid transformation. So the letters are just now going out to our clients. We have provided training to all Medicaid front desk staff, anticipating that our call volume is going to increase significantly in the near future about this transition. The actual application volume shouldn't change, and we should be doing the same things, but we do expect a lot of confusion from some of the clients. Making this a little more challenging, we have had difficulty in maintaining adult Medicaid workers. We've had continued turnover in that area. We are trying to be creative in how we do maintain that coverage. And with the COVID and the state allowing us to roll recertifications, that's kind of allowed us to keep our head above water in that one area. Lastly, program integrity. We are being encouraged from the state to prosecute perpetrators of fraud that apply for services that are not eligible. This can be a time-intensive process and will require collaboration with the DA's office and the court. One of our, what we've been told just recently is part of why the state's doing this is potentially the way it would be implemented from what we're told is that when a case is identified for prosecution, the state would expect the county to pay that back to the state, and then we would have to get any reimbursement from that client. So it would hinge on us being successful in that prosecution. Right now, we are working on our protocol for that process and looking to determine what level of fraud determines that you should prosecute and when you shouldn't, and make better decisions before we just kind of randomly implement that plan and that protocol. Any questions so far? This next area of challenge has really kept us busy in the last few months, finding placements for our high need youth and adults. We talked about this a little bit last month, but 2 months ago when I was there, but it's become even more challenging recently. We've had clients released from prison with treatment requirements. that maybe were getting a little less than their required treatment while in prison and now are unstable. We have had ones with restrictions on what kind of placement they could go into. And the biggest challenge has been kind of a lack of warning. We were told one person that was going to be released on a Sunday and then got called the Thursday before and said, we're a little early, come and get them today. And a guardian we needed to find placement for. One of the things to run in with youth that's a challenge is the disruptions of placements. A lack of emergency placements for those disruptions that come with no warning, or at least we haven't been warned. And that has led to a couple of times we've had youth sleeping at DSS, which is not a good situation whenever we can avoid that. Not just because it's uncomfortable for the youth, but if they have a high mental health or suicidal or homicidal, it also puts us at some risk here in the office. One of the concerns when we do find a placement is the coordination between systems to make sure that their treatment is timely. I'm going to finish the next slide and then I'm going to introduce Jesse Smathers. So as we go on to the next slide, we talk a little bit more about coordination of those treatment needs. Sometimes when we do have a disruption, it can take a month to get all the information from one previous provider to the new provider, get new services and new treatment. And when this client needs it the most, they're kind of caught between authorization programs. They might be different LMEs, different therapy providers. Just the whole system needs some improvements. One last thing, which is really across the state an issue of the increase of guardianships that have been showing up across almost every county. We've gone up 10 to 15% just in the last couple of months. A letter from one of the other county directors to the state is where this quote comes from, that guardianship has essentially become an unfunded mandated service where we are kind of given responsibility to take care of this adult, help make decision-making with no funding to help support all the processes and the work we need to do that. At this point, we've set up Jesse Smathers from VIA. He is going to talk a little bit about their work for these placement issues and is also available to answer questions if there are any related to the Medicaid transformation.
And can I ask a question before we get to there, please?
Yes.
And it goes back to the adult services.
Yes.
You said that the meals was $1,500 a person per year, but then you said $6,000 a year. What was that for? I didn't follow you there.
Yeah, I'm sorry, I'm going a little fast tonight. I can hear myself, but the in-home services, the other part of adult services, usually averages $2,600, but based on the number of hours that are needed by an individual, it can sometimes range up to $6,000 for that person per year for those in-home aid services.
Okay, so it's people going into homes and taking care of people, in-home services.
It's all level one that we provide. Level two is more person care. Level one that we provide is just helping with chores around the house, housekeeping, errands, those kind of things, not really taking care of the person themselves, but it's deemed as a service to help them maintain independence and stay in their home.
Okay, thank you.
You're welcome.
Well, good evening. Thanks for having me today. Thanks for the introduction, Linda. My name is Jesse Smathers. I'm with VIA Health. I believe I presented to y'all about December of 19 before the world was turned upside down by the pandemic. And we were still unsure of what was going to happen with Medicaid transformation. Well, budgets delayed Medicaid transformation. And then the pandemic comes and it's changed the way we're doing a lot of work. It has definitely increased the challenges that we're having with placements for people with severe and persistent needs. It's a statewide issue. We're doing a lot of work trying to address and change things so that the challenges aren't as great. I think the statement that Linda made about guardianship becoming an unfunded mandate, I've been in the system long enough to where I remember when guardianship was divested away from area programs in 2004. And the responsibility became that of departments of social services for people with mental illness. And it's been a continual challenge since then. As you all know, VIA is the local management entity, managed care organization for Alexander County. We serve 21 other counties. And my role is a community relations regional director, and I'm currently working in 6 counties, but that's expanding to 8 as we reorganize in some manners to be ready to be a tailored plan in the Medicaid transformation program. Some of the things that we're trying to do to reduce the need for placement is increasing a larger option of services through, well, our community-based continuum. We know that if we are able to keep kids in their family home without having to remove them, that we have a lot better chance of reducing the burden on the system. So we're working with our network of providers to try to increase the availability of some evidence-based practices. These include high fidelity wraparound, intensive in-home, multi-systematic therapy, family-centered treatment, treatment alternatives for sexualized kids or TASC, intercept, and transitional use services, because there's a huge challenge for youth 18 to 21 as they're aging out of the Medicaid system. And often I've never had a real opportunity at a stable life, and then them trying to transition into adulthood and meet their needs. We're also working to expand access to crisis services, and we have expanded that pretty significantly. Mobile crisis management is provided in Alexander County by RHA. RHA's had a stable director now for about, in the region, has had a director stable to the region for almost a year and a half now. And we've had a lot more success with the mobile crisis management program under her leadership. For children, we have opened a child facility-based crises option in Asheville. That is operated by Daymark. It's not operating at full capacity currently because of COVID, but they are doing a great job of accepting some of the more difficult kids when they mix with the other clientele in the operation. We have developed a number of emergency respite facilities. We have a 5-bed respite facility in McDowell County called a Care Haven. A Caring Alternative operates that. And then we have a 4-bed facility in Buncombe County called Interlude. Those beds have stayed full for most of the pandemic just because of challenges in placing kids. One thing that has happened to the system is court systems aren't meeting as frequently as they used to. All the pieces are occurring virtually, and in some cases not as often as they did. So that's created stop. I guess it's almost like a plumbing drain getting stopped up. If one thing stops, it just backs up, and you always end up dealing with it with a lot more severity. We're working to open another respite option in Jackson County. That will be called Hawthorne Heights. We hope to have that opened by July. We have reached out and have started work with a provider also called Anderson Health that's based in Marshville, North Carolina. This is going to be a program that's exclusive to members of VIA, or people that live in our 22 counties or Medicaid out of our 22 counties, and it's called the Nucleus Project. And we're currently in phase 1, and we're slowly creating capacity for level 1 emergency cottages that will have clinical and nursing support. Our goal is to have 20 beds through these cottages. Currently, we have 3 open. They're adding about a bed a week. There's also plans with Anderson for them to open a level 3 home and a psychosocial rehabilitation treatment facility. And when I'm talking about levels and therapeutic foster care, the higher the number, the more severe the need, and the more focused the treatment that the person receives. We're also working with Access Family Services to develop some specialized therapeutic foster care for kids with autism spectrum disorder. These homes will be unique in that the foster care parents will be trained in applied behavior analysis. That's considered a best practice in serving kids with autism. And the applied behavioral analysis services that the therapeutic foster care families are providing in these settings will be monitored and supervised by a board certified behavioral analyst, because that's a requirement of the ABA, or Applied Behavioral Analysis Service. We're working with Access Family Services to create 10 beds. It'll be a pilot, and if it goes well, it'll probably be expanded statewide. We've also entered into agreements with Thompson Child and Family Services to develop something a little bit different than therapeutic foster care. And this is called Treatment Foster Care Oregon, because it was developed in Oregon. It's an alternative to institutional and group care placements for kids. It is for kids with severe and emotional behavioral disorders, but the goals of the program are to keep kids with a family without them ever going into an institutional setting, because most of the research in the field shows that once a kid gets into a psychosocial rehabilitation treatment facility or a PRTF, they often go back multiple times. And the more often they go back, and the more institutionalized they become, the more dependent they become on the system. So the better we do on the front end of keeping kids out of residential treatment facilities, the less challenges they usually have later in life. And we're also, for more emergency supports, working with Clear Sky Behavioral Health to develop a program that specifically targets males that are ages 15 to 17, because that age group is really a very difficult age group to place in some cases, especially when their needs are really severe with regard to behaviors. Let's see. We've actually acquired a couple of grants. We received one from the North Carolina Department of Health and Human Services. We were awarded the grant in July of 2019, and the grant was to expand high fidelity wraparound into 3 of our counties, Alexander being one of those counties. And by the time all the paperwork was started to move the grant forward, the pandemic hit, which slowed progress down. But high fidelity wraparound has been increased. The use has been increasing in Alexander County, which that's a positive. And we also recently received a grant award from the Substance Abuse Mental Health Services Administration that's going to impact Alexander County. This is a 4-year grant totaling $3.9 million that targets 7 of our counties. And it's to, the goal of the program is to improve mental health outcomes for children and youth with severe emotional disturbance by increasing the communication between all the organizations or agencies that have to manage care. I know Linda mentioned how difficult it is with the communication pieces. In North Carolina, pretty soon we're going to have 6 health plans. We're going to have 4 to 7 tailored plans, 100 to DSS offices, and not to mention all the departments that are part of the Department of Health and Human Services that have to coordinate. Because in some cases, we run into barriers with the Division of Health Service Regulation and trying to find a place, which is a case that we have going now. Let's see, I think we chose Youth Villages as the provider of the system of care grant, because they were also the provider of the high fidelity wraparound grant. The two services work well with one another. And that's all I have about what we're trying to do to increase placement. But at the same time, no matter how many placements we have, it seems that we're always going to occasionally encounter an individual that just doesn't fit into the boxes we've created. So it does put a lot of stress sometimes on local DSSs, especially when guardianship is the case and there's no kinship options. But I'm also willing to talk some about Medicaid transformation if you need to, but I think Linda covered that really well. So I'll entertain any questions if you have any.
I wanted to really build on your comment about communication, because I think that is key. I think one of the things that we need to improve on is even starting at the very beginning with the family foster care and therapeutic ones. A lot of times they think they can hang in there and keep saying, you know, oh, we got it under control. And by the time it hits a crisis, we somehow have to help people change the culture that it's not a bad thing to ask for help with some of these challenging kids. And that's just, you know, that's just how we all are, especially the ones of us that are in this field want to help people, and we want to try to do it as long as we can. But that would really help us maybe prevent getting to those higher levels of care. So yeah, there's no easy answer to any of this. Any other questions? Thank you, Jesse.
Thank you.
If we can go back to the slides. The next thing I was going to talk about really is the family prevention. So it will build right onto this challenge of placements. As I talked last time, the change in child welfare is going to be to prevention from foster care. So the federal government's going to start taking funds that were previously designated for board payments in certain types of board payments and put them more into prevention. The intent is to keep the pressure on DSS to not use group care as much as possible. When we were talking to the LME and creating our budget, they did make a comment that this is one area that Alexander County does exceptionally well. We have very few children that are level 1 and 2 and that are in residential care. In other words, those ones, group homes, level 1 tends to be a group home where people just can't find a foster home. They've run out of all other placements and they put them in a group home that they don't necessarily need it for treatment reasons. That's the types of placements that the federal government's trying to really discourage. And that whole implementation starts this July 1st. And that's why we've been working so much with VIA and other people on communication and getting ready for this as it is implemented. The next couple slides really actually, I'm sorry. First, I want to talk about, before I get to the next episode, this slide just talks about what we've already started to plan in Alexander County to get ready for these prevention planning. We are not at this time asking for any budget changes. We are looking to shift half of our full-time equivalent peoples from staff from intake assessments and foster care to do outreach. For example, when we get a call and a report doesn't meet the criteria to be screened in, but we believe they could benefit from service referrals and help in the community, we will call them up and ask them if they're interested in any voluntary assistance. This would not be mandated, where we would come out and meet with them and help them with referrals to the mental health system, any of the local community parenting, any other services that we could help and hopefully prevent their family dynamics from escalating. And so we never do hear about them again. We are going to pick certain staff and have them become experts in, more so than they are now. Most of our staff tend to know quite a bit about a lot of different areas, but we'll pick ones to be specialists in mental health, substance abuse, domestic violence, that will kind of be a resource within our own DSS. If someone has a particularly challenging case, what provider do they think may be best to help them? Which ones may have openings very short and can have quick response time, and have developed collaborative relationships in some of these areas of expertise. And that kind of rolls in the last bullet again, that developing collaboration with what providers are aligned with how we want services provided that are trauma informed, responsive, and meet the family systems dynamics of the families addressed by, that are served by child welfare. So the next slide, I really get into some numbers here a little bit. This first one here just shows why it's so important for us to keep up the drive to license family foster care in DSS or neighboring counties. The first table shows the cost per month for a child depending on their age. The column shows the county cost if they're 4E federal, or the county cost if it's state funded. And then the average, we have about 14 of our kids at any point in time in a DSS home or in a therapeutic home where Medicaid's picking up the difference. And this is the cost to the county. Unfortunately, if we don't have a home licensed in Alexander County, then we have to go to the next table and we have to go to a family foster home licensed by a private agency. The amount of cost goes up considerably. You can see it's almost $1,000 for any one of them. That covers the overhead administrative costs for that private agency. So they monitor the home, they license the home, they visit it in addition to us. And then, so the next two columns show approximately the cost to the county for those private homes versus the top table, which is ones that are DSS homes. We have about 8 children at a time that are in these private homes. So that means we are paying for each of those children $200 to $500 more a month for them to get family foster care. So that's just kind of giving you a ballpark right now. We don't expect that to go up or down. It's just if you get an opportunity, which I'm sure you already take advantage of, to help recruit families for DSS licensing, we appreciate that continuing. The next slide really talks about how with this Family First Prevention Act, how the impact is going to hit the county because of money being redirected. As Jesse said earlier, the level 1, 2, 3, and 4, the higher the level, it's the higher level of specialized treatment. So level 1 is really a child that doesn't need residential treatment at all, could be easily in a family foster home, but for some reason we haven't been able to find them. Alexander County typically only uses these kind of placements for emergency placements. If we have a child, for example, when we had a teenager recently had a disruption, didn't have another placement available, and he had to go in one of these residential treatments until we could find another home. That's why on the estimated number of placements, the 0 to 1 in Alexander County, we typically don't use those placements unless it's a last resort. The only other time we've used them is when we have a family maybe of 5 siblings. We really try hard to keep siblings together. And occasionally when we haven't been able to get them anywhere near each other for a short period of time, especially right after being removed from the home, we may put them in one of these, a group home like this, so they can at least be together during that transition period. That hasn't happened in Alexander for a couple of years, but so we do a really good job avoiding those placements, which is good, because if you see that third column there, that $37.80, which is what the new cost per month versus $736 to the county would be if we have to use one of those placements after October 21st, 2021. Level 2, again, then it goes up again. What are the changes in cost to the county for those? The total cost drops significantly, not because we're now starting to get into Medicaid coverage. So some of their cost is covered by their mental health or medical need. So the total cost isn't $634, but that's what the bill that comes into us. And then we pay a certain share, and the county, the state or feds would reimburse us a certain part. But as you see, the amount we would pay is going to go up significantly. Again, we have very few times we use this level 2. Level 3 is the ones we're more apt to use. The level of the cost of care goes up, and the county share cost for level 3 is probably the biggest ones we're concerned about in the next couple of years, or well, as far as long as this continues with the funds being reallocated. My numbers here actually might be a little low. The estimated number of placements, I had 1 to 2. recently with challenges, we've been averaging a little higher than that. And that fourth column there shows that our cost per month, increased cost to the county, is around 1,680, could be higher than that, could be closer to 24,000, 2,400, 3,000 a month for children in that group, because my numbers are a little low in the estimate there. On the last one's the level 4 treatment, and those numbers should be fairly accurate. That's the area where we don't have a lot of, there is no impact to us. That's the highest level need. They recognize that when a child needs that high level of need, there isn't really an alternative. So they aren't reallocating money support in that area. So the estimated total per month is 3,000 to 5,000 is our very ballpark guess of what may hit our bottom line as the cost for using residential treatment for kids in foster care based on the needs they have. It's totally a guess because we are never sure how many kids we'll have in those levels of need. Does that make sense? Is there any questions about that? So as we move forward, just talk a little bit about our impact on our headcount. We are continuing our work to improve staff retention and reduce turnover. One of the ways we think we will be successful in that is to implement a position of income maintenance training QA supervisor. Based on research we've done with other counties, most counties have full-time training people. For example, Catawba County has 2 full-time people just in adult Medicaid, another 2 in their child and family Medicaid, and then more in family and nutrition services, food and nutrition services, excuse me. We incorporate that into our QA and our supervisor role. We believe that there's a real growth and potential in our ability to effectively train new staff if we could have someone that more specialized in that. We are looking at ways to do that creatively and with our current staff, but it is something we're looking at for the next year. Also need to just let you know that during COVID, because they have allowed us to auto roll cases for recertification and just automatically approve them versus a review of them. When COVID ends, we won't have that ability anymore. And so during COVID, we had placed a couple positions on hold and did not recruit or post for them at all. Once this allowance to auto roll is lifted, we're going to have to post and fill those positions to keep up with the work volume. In this last year, we also focused on stability and worker performance in child welfare. QA is a position that's been identified as a need in child welfare for a number of years now. We do have QA in adult and the Medicaid and food and nutrition, but we don't have them in child welfare. With the increased focus from the state on MOU and improvements, we really believe we need to look at that position being filled. We're also looking at being creative if there's a way we can shift around what supervisors we have. We've already reduced one of our in-home staff. So I'm talking mainly about increases, but I really haven't put on here increases that we've made in staff, which I realized after I turned all this in. On adult services, I mentioned this earlier, we just hope to increase use of volunteers. So we do not expect to increase any need for people here. But we still hope to increase the number of citizens we can serve if we can find a way to be creative. The next things just talk about, some of this is what I talked about last time I reported. It's just a reminder. I told you that we're going to have to track Social Security income next year. It really hits the finance and the expense side of the spreadsheet. So it doesn't really change the total, but it's going to look like our budget went up. The reimbursement for foster care that's going to be taken because of Family First, we estimate that's somewhere around $40,000–50,000 a year. Now, will that be shifted to the implementation of prevention services? That's what we've been told, but we have not been told what that will look like and what that amount is. Hopefully that does happen, and then it would balance out. Right now, we don't have the numbers to put that in our budget to account for that. We're very concerned about the increase in guardian cases. We don't expect any change in funding there. This next number is incorrect. I made a mistake on the COLA. That's double what is true. It's half that. 85,000 is what the impact to the DSS salaries will be. I apologize for that. We actually expect to decrease our line item for technology. As you earlier in the meeting approved a budget request, we have effectively used COVID funding to do some technology improvements for CPS, APS, and we hope that'll offset our technology budget and actually have that go down from what it's been in the past couple of years. And then these are the vacancies I've already talked about that we had left vacant we're going to need to fill. So I've put some impact to potential increase, but as I said on the previous slide, there are some areas that we've do look at there being decreases too. So we haven't finalized the budget, just kind of giving you some food for thought as we get ready for the budget season, not really asking for you to approve or not any of these items, just things that you'll be seeing. Are there any questions about that? The only other thing that will hit our bottom line budget is that the allocation of, I guess, maintenance budget will be reallocated into ours. So you'll see an increase there, but it's not really an increased cost to the county, but it will show up in our budget. All these others, the meals program, these are all things that if the county chose to invest, we could put money in the budget. Right now, we're not to take people off the wait list. We are being creative and have thought about the potential of a grant writer to help get more funds for adult services and other areas. The crisis response fund is the recognition that if we have to open shelters, we have zero budget allocated for that. And we are also working with emergency services to set up MOUs to have the community available to bring things like food and help with shelter, which really came through this year, as we saw with Hidden Night. This is just kind of an insurance possibility where we have this crisis fund here. The economic service training position I've talked about. We've also talked about 2 Medicaid positions redoing their job grade to help with maintaining and reducing turnover. The last one here, this economic services payback fund, we are concerned it was in the budget previous years. It's kind of the insurance plan if we are cited an audit and have a payback. Because this year of some of the turnover in adult Medicaid, we're just a little concerned that we hope there were no audit eligibility decisions. I mean, decisions made wrong, not that, or concerned that audit may find something that they have not in the past. So I kind of put some total numbers in here, but they're really not finalized numbers. So I just want to make sure people were aware of that. Any questions on any of those items? I know I'm going fast, but the last 2 slides here, this one here is on performance data that you all, I think, actually signed the MOU, the Memorandum of Understanding with the state about which data they were going to track for DSS performance. So I thought it would be good to give you a quick update on how we're doing to date. This MOU for us goes from January of this year through July of next year. And these 10, 12 different measurement metrics have been set up to monitor how well we're doing. And I don't know that these are all put in place for the Ryland's Law requirement. And there's 2 in red where we are somewhat below the required target percentage. The first one, however, is the timely completion of APS reports. We normally do excellent. This is a bad month. Normally they're at 100% all the way across the board. This one month, they were late on 1 out of 5, and it drops really quickly when you just miss one. So it went down to 80%. But so this is for 1 month of time. Most of these numbers are the last month in the MOU. but in general, that area is 100%. So at the end of the year, I don't anticipate any issue there. You can see a lot of them, we're right at 100%, 97% in child enforcement, support enforcement. The other area where we have red, where we're slightly below the target, is foster care face-to-face monthly visits. That's an area where we have struggled a little bit in really just making sure our paperwork is current. Every time I've gone in the last 2 years and gone back and looked at that number, we were really at the 95, 96%, but for some reason, 1 or 2 children's visits wasn't put in the system, but we will follow up on that. So at this point in time, we are doing really well on meeting the state expectations for performance on the metrics that they've set up. And if you wanted in the future to let me know if you want those updates regularly, or just let me know. This last one here is the, go ahead. No, this last one here is the bills that are in the committee that could have an impact on DSS. First one here is the consideration of having dental services covered in Medicaid, part of transformation. NC FAST, child welfare case management, still apparently on schedule for implementation in 2022 to reincorporate child welfare into the NC FAST system. They're supposed to be putting case management improved capability into the system. The regional supervision, even though it's still in committee, some of this has already been implemented. Child welfare has gone to regional supervision, as has adult services, but not yet in income maintenance activities. The social services reform is this family first prevention services, a lot of which has already been discussed about previously in the presentation. And this last one is, would be very helpful. This is a way to allow parents whose children have been removed by DSS for foster care to continue to get Medicaid services so they can engage in mental health or substance abuse treatment. Right now, they lose eligibility as soon as they don't have a child in the home. And it's really difficult for them to address an issue they may be willing to address, but or have difficulty getting services. And that's all I have. I know I was talking fast tonight, but hopefully that information is helpful. Any questions?
No, ma'am.
Very good report. Thank you.
Thank you.
Appreciate it. Jesse, we appreciate you joining us tonight. I think it was back in 2019 when you were with us, and it's always good to see you and appreciate you being here.
Sure. Thank you for having me.
Yes, it's very important that people know what Value does and the contributions they make to our county, and to help everyone that needs the assistance that they can. And I'm glad to see that you continue to expand and trying to find other facilities to place these young folks when they need help, and to take care of them. It's vitally important. Vitally important. I think, like she was saying a little while ago, that the biggest problem is that when we don't ask for help, it's no problem. I mean, it's very important. That's the biggest disservice we do to ourselves or to our children, or when they're having problems, that we do not ask for help. It's nothing to be ashamed of, because I think all of us at one time or another always have a confidant we can talk to, but sometimes these young folks don't think they have anybody that they can turn to just to discuss things, sometimes just to get that little frustration out. And that early observance of these folks that have a problem or something is vitally important to the well-being of that young person. But thank you for what you do, and we thank you for being here tonight, and thank you for the presentation. And with that, gentlemen, anyone else have anything? If not, we'll stand adjourned of the Board of County Commissioners Consolidated Human Services Board meeting, and we will move into closed session for the Alexander County Commissioners under the general statutes of, I'll get that in just a second. Under general statutes 143-318.11, paragraph A, 4, 5, and 6, economic development, contractual and personnel issues. We will reconvene for the purpose of adjournment only. No action will be taken. I make that in the form of a motion.
Second.
Motion is made second. Any discussion? Those all in favor indicate by raising your right hand. Those opposed likewise. Thank you, gentlemen. Good night.